Chronic ankle sprain physical therapy. I recently saw a patient in my office who suffered from severe pain in both ankles and instability. She already knew she had arthritis and wondered if an ankle joint replacement or an ankle fusion procedure she read about on the internet were needed. Supposedly, she had sprained her ankles multiple times over the years, causing a lot of cartilage damage. She is a full-time nurse, so she stands who walks on her feet all day, and could not afford to take time off for the recovery of such an invasive surgical procedure. X-rays did indeed reveal very arthritic ankle joints with bone on bone, which means little to no cartilage is left. Therefore, conservative treatment was initiated. She had cortisone injections, was prescribed oral anti-inflammatory medication and obtained a pair of customized orthotics inserts for her high-arched feet and a pair of ankle braces. This gave her over 80% relief, but the cortisone started to wear off after a few weeks and she wanted a more long-term solution. She subsequently had an MRI performed of both her ankles and it revealed severe joint damage, and even a loose piece of bone in her joint. As she still could not take a few months off for an invasive surgery, she opted for ankle arthroscopy. Ankle arthroscopy is a minimally invasive procedure where small stab incisions are made on each side in the front of the ankle and a small camera is placed inside the joint. Boy, were there a lot of lumps and bumps in her ankle. There was severe cartilage erosion and lots of inflammatory tissue. So with the use of small instruments, her ankle was cleaned out. This cleaning is called a debridement. All the inflammatory tissue was removed and small holes were made in her exposed bone in order to promote healing. The bone should not be exposed, but there was no cartilage, and it was literally bone rubbing on bone. The small holes made in this bone will bleed and this will facilitate pseudocartilage formation to fill in the defects called osteochondral lesions. Ankle sprains are one of the most common foot and ankle injuries seen by physical therapists. An ankle sprain occurs following a sudden sideways or twisting motion of the foot. This can happen during an athletic event, taking an awkward step or walking on an uneven surface. An ankle sprain is an injury to the ligaments in the ankle. Ligaments connect bones to bones and prevent excessive movement of the joint. When an ankle sprain occurs, the ligament is stretched too far and can be partially or completely torn. There are 3 types of ankle sprains, the most common being inversion ankle sprain, which occurs about 90% of the time. With an inversion ankle sprain, the ankle turns over so the sole of the foot faces inwards. When this happens, the outer ligaments are stretched too far and damaged. The anterior talofibular ligament is one of the most commonly involved ligaments in this type of sprain. With this type of sprain, pain is typically located on the outside of the ankle joint. Another type of ankle sprain is the eversion sprain. This happens when the ankle rolls so the sole of the foot is facing outward and the inner ligaments are damaged. The most common ligament involved with this type of sprain is the deltoid ligament, and pain will typically be located on the inside of the ankle. The high ankle sprain is the least common sprain. This can occur when the foot is forced to rotate away from the other foot or when the foot is planted so it cannot move and the leg is rotated inwards. With this ankle sprain, the syndesmosis ligaments are injured, which are located above the ankle joint. The amount of force placed on the foot will determine the grade of the ankle sprain, which tends to correlate with the severity of the symptoms. A grade 1 ankle sprain is when ligaments have been stretched but not torn. Symptoms include mild pain, mild swelling, mild joint instability, mild joint stiffness and difficulty jogging or jumping. A grade 2 ankle sprain is a partial tearing of the ligaments. Symptoms include moderate swelling, mild bruising, moderate pain, moderate joint stiffness, moderate joint instability and pain with walking. In a grade 3 sprain, the ligament has been completely torn. Symptoms include severe swelling, extensive bruising, severe pain, gross joint instability, extreme loss of motion, extreme difficulty with walking, and a giving way sensation may be present. Physical therapy is important in reducing pain and swelling and preventing chronic ankle problems. In the event of an ankle sprain, your physical therapist will give you exercises to restore joint mobility and stability as well as retrain joint proprioceptors. Joint proprioceptors send messages to your brain to give you feedback about where your body is in relation to the space it occupies. When the ankle joint is injured, the sense of position is affected and therefore the brain does not receive the appropriate messages from the joint to avoid injury. This can lead to problems with balance and coordination, ultimately resulting in recurrent ankle sprains. Physical therapy techniques can retrain the joint proprioceptors by utilizing specific exercises and activities that challenge balance and reaction time of the injured joint. Physical therapy will help strengthen your ankle, improve proprioception, and reduce the risk of a reoccurrence. After the surgery, I spoke to her husband for the first time and he revealed that she used to own a horse and rode horseback all the time. He said she suffered multiple falls off the horse in addition to twisting her ankles around the stable. So this is why her ankles were so bad. It is always helpful to speak to the family as she never revealed this to me. It wasn't quite clear why both her ankles were so severely damaged, as this was chronic ankle instability as well as post-traumatic arthritis. Postoperatively, days after the arthroscopy, she had no pain. This procedure of arthroscopic ankle debridement can be done more than once. This may help her long-term and prevent the need for ankle fusion or replacement, but most likely it will not. Ultimately, this will buy her some time of pain relief at least, and she is very grateful to have this time of comfort. Ankle instability is exactly what it sounds like, a feeling, especially on uneven surfaces, where your ankle constantly twists inward. Ankle instability occurs more often to people with high arches. Those with high arches have feet that are too rigid, so their feet cannot adjust to this uneven surface, such as a dirt road or grassy surface. This leads to a tearing of the lateral, outside ligaments of the ankle. The ligaments, which connect bones together, help to stabilize the ankle. When these ligaments stretch or tear multiple times, the ankle becomes unstable if left untreated. Sprains can occur, but also tendon tears, stress fractures, and, as in the case described above, osteochondral cartilage defects or damage can also occur. Over time, this leads to arthritis and chronic pain, as in the case of my patient. It can get to the point where the only options are surgical. The last resort is an ankle fusion to get rid of the remaining cartilage and make the bones one solid block of bone. A fusion will get rid of all pain, as the little amount of motion in an arthritic ankle causes the pain. So, no motion means no pain with the fusion. The patient will be able to walk and function normally, but will not be able to wear heels. Though if they are at this point, they haven't been able to wear heels for years anyway. There are new advances with ankle joint replacements. However, not everyone can qualify for this procedure depending on the position of the ankle. Prevention is the key. If you know you have high arches and feel unstable at times in your ankles, then go see your local pediatrist and simply get yourself a pair of customized orthotics to stabilize your ankle. Not the over-the-counter kind, but a functional pair of orthotics. This will prevent a situation of chronic ankle pain and instability described above. If you do sustain an ankle sprain, get treatment. Go to your pediatrist, get the orthotics, and start ankle strengthening exercises of the ligaments with a formal program of physical therapy. It is that simple.